She is the most beautiful doctor. You should see her skincare routine. You should look at her recommendations of weight training and you'll get a lot of patients. They say this statement, why do I need to test?
I would say just one sentence first, and that is what gets measured, that gets managed. I am completely obsessed by taking care of myself. Aging is basically the decline in your biology and in your physiology of the whole body systems. There's a saying, living person has 1,000 wishes, but a dying person has only one wish, to be living, right? You got to be taking care of all those very basic foundations, and those basic foundations are easy. They are low cost. You don't have to depend on a lot on the doctor's visits and doctor's fee. You don't have to depend on pharmaceuticals fee. It's all in your own hand. Very simple approach, very simple techniques. Basic foundations are like,
when people come to my nutrition clinic, 67% of it is for weight loss. They are not focusing on the longevity and the muscle.
people just see the physical picture. They all want to see the results in 5-6 weeks.
You have a routine, and I see it on the internet. Two routines I want to pick your brain because that's what our fans and listeners want to know. What does this beautiful doctor do? Give us in short. What do you do in the gym? Give us in short, what is your skincare routine?
My skincare routine is
What if I told you that the way we age isn't just about ticking years off our calendar, but about the choices we make today? What we eat, how we move, and even how we think. In this episode of Health Heroes, we dive deep into the art of the science of aging gracefully with Dr. Manisha Kukreja, an integrative health and wellness expert admired for her beautiful and radiant skin, boundless energy, and the remarkable fact that she's a mother to a son who's already a dentist. And yet she looks like she's defied time. We unravel questions like, can we truly slow down aging? Is health span more important than lifespan? And what toxins might be sabotaging our health without us even realizing it? Dr. Kukreja shares her secrets, from foods for glowing skin to post-40 must-haves for women, along with her personal wellness mantra. Discover the untold truths about aging gracefully and learn how to turn back the clock on your health and vitality. This episode is a game changer you can't afford to skip.
And I've been joined by one of the most talented and most beautiful doctors I've ever known on the planet. And I have worked with her during the pandemic period on training dietitians and nutritionists across the world. She's a specialist in autoimmune conditions, the immunity of the human system. She's a author coming up with a new book, but I'm not allowed to talk about it right now. And I can't wait to bring the next podcast with her. But without much further ado, Dr. Mani, how are you doing? And how's the weather there in Florida?
I am doing great, and such a beautiful introduction that you gave, Ryan. I am so glad and I'm excited to be here talking to you.
When my team and I said, let's go and interview somebody of medical standing, um, who the common man, the common woman especially can associate, I immediately told my friend, there's a Dr. Money, because I know you by your short form, which is Dr. Money. She's like, sir, we can't find a Dr. Money. I said, search for Dr. Manisha Kukreja. She is the most beautiful doctor. You should see her skincare routine. You should look at her recommendations of weight training. So I was taken aback when I realized that you have a son who's a practicing dentist who actually looks like your sibling, your better brother or sister. So, what's the secret to your age, doctor?
Oh my God, that's a very flattering introduction. I love that. Thank you very much for that. So, one, I was married young. Plus, also, secondly, I am completely obsessed by taking care of myself. Because for me, I know I am medically trained physician, but for me, what matters the most is the health. Health is the foundation of goodness, right? So if you have good health, then you can achieve all the goodness in life, all the goals, all the achievements that you aim for. That's all possible when you have good health. There's a saying, there's a quote that living man or living person has 1,000 wishes, but a dying person has only one wish, to be living, right? So the foundation of whole humanity and goodness is all about health. And I know, being also trained in as a traditional physician, traditional medical physician. I know, traditional medicine is all about basically bandaging the symptoms with the help of pharmaceutical. But when you take care of your health from integrative point of view, when you take care of your health from prevention point of view and from root cause treatment point of view, you not only treat the symptoms, but you also avoid many other multi symptoms which are coming from the disease. Plus, also, it's a root cause eradication, and that should be the foundation of the treatment of any problem that you have. Because in our body, it's all interconnected: mind, body, our gut symptoms. If we have constipation, if we have diarrhea, if we have skin disease, psoriasis, eczema, or maybe we have headache, it's all interconnected. It's that your body is trying to tell you that there are some underlying cause in the body that's actually showing in those form of all the symptoms that I just mentioned to you. So taking care of your own health is paramount, is essential, because healthcare system is not built in a way that is going to basically be present all the time with you. It's basically just going to be taking care of the sick care, not your prevention of the disease. Plus, also in United States here, it's so expensive and so neglected that you cannot see the doctor at the time when you really need to, or maybe you have to wait for the doctor's appointment, and it's expensive. Food is so expensive and the outcomes are not that efficient. So if you try to take charge and authority of your own health, I think that matters so much. And that is a reason I definitely wanted to study integrative medicine along with my traditional medicine that I was actually trained for. But I did also my clinical research in prevention medicine, in clinical research and integrative medicine. I also did study nutrition, and all that together actually made me to go on this path where I am right now. I have this whole career where I treat my patients and my client, treating them from the root cause of the disease and totally help them to reset and optimize their health.
So, doctor, when you talk about treating your patients, your clients, and you go to the root cause, now, people always like to look at the practitioner and say, what is it that they are doing? And you have amazing skin. And I want to take this direction of discussion from you as a doctor have understood that your body is the most expensive real estate you will ever own. And you technically live in your house as a landlord. So you take very good care of it. But as a medical expert, how much of it is going to be genetics and how much of it is actually the effort involved to take care of yourself?
Very good question, Ryan. Absolutely. I'll tell you. So, when all these research scientists of aging, when they were trying to figure out why aging happens, right? So, aging is nothing. First of all, I'll define aging in one sentence, even though it's very complicated, but I try to make it simple. Aging is basically the decline in your biology and in your physiology of the whole body systems at all the levels, at cellular level, molecular level, tissue level, organ level. And this decline is so complex, and it's actually a gradual decline, and that leads to the reduction in the lifespan, and that leads to more risk for age-related diseases. So this is how you define aging. So right from the age of 35, we have seen, in so much data after data, so many research, medical data, integrative medicine data, that right after the age of 35, your body basically declines. So in all the form, in your peak performance, your energy level gets low, your body muscle mass is not as good as you want it to be, and all the systems get affected, and there's a decline. So if you are not taking care of, particularly focusing on those areas of your health, the body is going to decline steeply. And I've done this 10 years of research, and I've published so many papers, and I've seen patients going through a lot of health, when they have a disease and how the health declines, it's quite steep. So basically, so you got to be taking care of your health. You got to be taking care of all those very basic foundations. And those basic foundations are easy. It's not easy, but they're simple. They are low cost. You don't have to depend on lot on the doctor's visits and doctor's fee. You don't have to depend on pharmaceuticals fee. It's all in your own hand. Very simple approach, very simple techniques. Basic foundations are like sleep. You're taking care of your nutrition. You're taking care of what you put in your body in terms of nutrients, and you're taking care of your body by not taking too much toxins around you, not taking too much toxins in your body. And also movement is so important. So all those factors, in a very optimized and balanced way, they help to correct the aging as well as the progression of the disease.
Doctor, this is awesome. So you're giving us a holistic view of how people should understand that at 35 the system breaks down, and you've got to make the effort, and you don't need to spend a lot of money. It's with your sleep, it's with your diet, it's with your movement. Um, you mentioned something about toxins, and so my question is, one is to take charge yourself, but you live in the USA. I live in India. To our Indians living in America or the Indians living in India, we have a set of genetics. We are going to age. How much of aging is influenced by the environment, and what are the factors that your clients in US or my clients in India, what should they be looking like if you were living in India with us here, or what you do in the US? Is there something in your routine from the environment that Dr. Money is taking care of?
Yeah, absolutely. So, just like I said, aging is inevitable. Definitely. It's going to happen. It's going to happen in any case. But only 20% of it is genetically controlled. And 80% of it is all lifestyle control. When I say
Wow.
life, which is a good news that, there's a lot in our own hand. We can control a lot. So when I say lifestyle, that is what I'm talking about, these pillars and foundation, your sleep hygiene, your nutrition, your movement, and all the toxins all around you. Not only the physical toxins all around you, but also mental toxicity. That means your stress, how you handle the stress. So all those factors count a lot for lifestyle. And so 80% is all lifestyle, 20% genetic. So even if you're living in India, we are living in USA, somebody's living in China, Nepal, UK, wherever, but it's your own personal control, which is 80%. Like I have gone through so much genetic testing. I mean, I know I was privileged to do that. Many people can do that. And I literally tested every single gene of my body, that as per the genes, as per my familial genetic composition, what is my cholesterol going to be? Am I going to have the heart disease? Do I have deficiency of B12? Will I
Can,
suffer
can you
from
share
iron?
can you share one of two things where they're like an absolute revelation when you did your genetic testing that is like, uh-huh, I'm a medical doctor, but this is a googly for me. Anything that you can share with us?
Oh yes, because I was not surprised to see my results. One of the results that actually shook me, that I am a lean person, take care of my health so obsessively. But what really shook me was that my cholesterols and my genetic composition for my genes for my cholesterol is going to be high. And it's I keep it controlled as much as I can, but if my genes have the high cholesterol tendency, like I have a ApoB gene, that it's one of the marker of cholesterol that tells you that you can suffer from heart disease. It's because of my mom. It's because of my father. It's because of my grandfather. Because I have very bad genetic history. And as per the Asian and Indian, I know most of us, many of us do have that kind of gene. So, but I'm fighting with it. I'm fighting every day to control it because I know 80% I can do that. So just recently I did all my very deep, all the biomarkers of cholesterol, ApoB protein, LDL, HDL, and all inside molecules that I could test for. And I also did some, testing for my heart, that my everything is okay, which was all good. I did the MRIs and everything, and it was all okay. It's just because I'm fighting with those genes in order to keep in order to fight with my genetic and familial history of the heart disease and high cholesterol. I'm fighting with it to keep it optimal. And that was the aha moment for me.
Wow. So, doctor, uh, You we get a lot of I get a lot of clients for diet, and you'll get a lot of patients for integrative medicine. They say this statement: why do I need to test? What will I get if I know that I am having high cholesterol gene? Won't it give me anxiety? It is better not to know, and I can live my life not knowing. What do you say to such people who now in 2024 onwards, we have this modern practice of crystal ball gazing, literally astrology of going into medicine and predicting the future, and it changes your behavior. So what do you say to people who's like, no, no, this is not for me?
I would say just one sentence first, and that is what gets measured, that gets managed. Anything that you measure, I mean, I am a total believer of data. I look at the data because I have done my master's in clinical research data. I have done tons and tons of studies. I have published so many papers. For me, everything is all about data, the numbers, and then I connect the science with it. I connect math with science. That's what I am. And so what gets measured, that gets managed. If you will not measure any of your biomarkers, if you will not measure your data of your biology, how will you get it managed? And for I give you one example. For example, just myself, I'll give you myself. I have seen so many tons of patients and clients, but I'll give you my example. I After my second child was born, I did suffer from autoimmune Hashimoto's thyroiditis. Okay, it's such a vague symptom that you will never realize that I have this illness or I have this sickness, right? I was tired, I was a little bit low in my mood, I was very fatigued all the time, I didn't have too much motivation. And I was like, I'm always a very hyper person. Otherwise, I like, what's really going on? And I know at that time I was going through a lot of stress because I had a new job, and I am a very type A personality. I'm a quite OCD person. I mean, I am a high achiever, so people like me, we just intentionally have stress all around us, we just make the stress all around us. And, it was a new job, new motherhood. And I suddenly had the eruption of some viral problems on my skin, the herpes, and I knew there is something definitely going on. My immunity is definitely very, very low at this time because I'm taking a lot of stress. I've gone through so much physiological changes because of my new motherhood, and it was just out of my hand. And so when I go to the doctor, they will just not check all this. They just want to do your um, basically comprehensive metabolic panel, just checking your blood sugar and your CBC and hemoglobin, all that basic data. They will never check your thyroid antibodies. So when I went to doctors after doctors and nothing could be discovered and found out, I took the charge. I was like, okay, I'm doing it myself. So I went through all this data testing. I went through all the biomarkers. I did T3, T4, TSH, all good. But my level of antibodies, that is TPO antibodies and T3 antibodies, were just touching. They were skyrocketing to almost 1,000, and the normal levels should be around 100. So it's a lot of increment on those antibodies. So those antibodies were the markers that actually indicated me that my own body's immunity is kind of just attacking my thyroid gland. And when I knew that I have Hashimoto's autoimmune problem, then I started to holistic, because I mean, I know there's no treatment for this. The only treatment that you have is steroids and immunomodulators. I didn't want to take all those chemical medications inside me when I knew that my lifestyle, like if I control my sugar, if I control my sleep hygiene, if I balance my sleep hygiene, and if I control my stress, all of it can be very nicely optimized. So this is what I did, and I did every holistic method and every holistic kind of strategy in order to manage this. So this is just one example I was telling you. So this is my message to everybody who's listening to me, that please check your markers, please check your biology. It's very important to check the data, because without checking the data, you will never know what is exactly going on inside your body.
Your personal example shared with us is so beautiful. I remember I had this one lady who came in from California, and 23 and Me is a genetic lab that screens your entire gene report. She got it done. She sent us the raw data. The raw data is the entire gene sequence. She sent it to us, and I specifically asked for the nutrition gene report. and this lady was drinking like 8 to 10 cups of coffee. I think there's something about America where the coffee is really beautiful, and it's just uh, what would I say? It's a concept of people drinking a lot of coffee, and she was very very hyper, not getting enough of sleep. I couldn't convince her to give up on the coffee from a natural point of view that it's common sense. And when we did her nutrition genetic marker, it came up that she was a low receptor for caffeine. Basically, her liver enzymes were not able to digest caffeine fast enough. So, the moment I said that to her, she was like, you know what? I would never listen to any doctor or nutritionist, but now that I know that this is my blueprint or my architecture of my own body, I'm going to try giving up coffee. And she actually went down from 8 cups of coffee a day to just one. And lo and behold, every possible clinical symptom that she had just disappeared. So I think in the olden days, I think Dr. Mani, when we practiced, we relied on very basic blood diagnostics, but now I think the genetics allows us to go to the next level. But as a medical doctor, I wanted you to explain to people out there, there's a lifespan and there's a health span. And you have seen that in the medical system, how the health span is actually decreasing. So one is to say that I want to live a long life, but then your health is. So could you give us your viewpoint on the difference between lifespan and actual health span?
Definitely. So, by definition, the lifespan is the number of living years, and health span is the number of years that you are healthy without any disease. So now with the modern technology, we have so many startups, we have so many biotechnology, we have all this new tech and new information and the social media and so much of education and awareness around us. We all want to increase, we all want to be living longer. We all want to increase our lifespan. But at the same time, we are missing something. We are not really, the last 22 decades of our life, our health is really bad. We are suffering from so many metabolic diseases. We are suffering from the disease of aging, that is cancer, cardiovascular disease, Alzheimer's, arthritis, so many of those problems, which are, and diabetes, obesity, all these are the diseases of aging. These are the metabolic diseases. So, what is, I mean, I don't see any sense that living longer, but the last 2 or 3 decades of your life is like hell. They are terrible. It doesn't make sense. So, the goal should be to decrease the gap in between the health span and the lifespan. And that is, again, you know, the lifestyle foundation correction, all these foundations that we talked about. So yeah, so I mean, we all are talking about longevity, we all are talking about, okay, increasing your lifespan somehow, but I think we all should be talking about betterment of your health and increasing your health span, so you can actually enjoy all those last years of your life when you're actually retired and you don't have to go to work, but you can enjoy those last few years of your life with your grandkids. You can really enjoy the environment, you can be vacationing, you can be walking yourself, you are not needing the crutches, you are not needing somebody to be taking care of yourself, you are able to go do your own grocery. So this is what the life should be. So there should be a very good balance in between lifespan and health span, and that should be the goal. So decreasing the gap between lifespan and health span, that is what I call optimization of the health.
I've been watching your Instagram profile, your routine, and I see that exercise and movement plays a big part in your life. Now, at my clinic where I practice in India, the Cornerstone clinics, we get a lot of women coming to us, and women have different lifespans, different age profiles. And um, I recently had a question from a lady saying, "Can you enhance our knowledge on women coming towards menopause, so the 40s to 50s and the post 50s, um, and you train and you weight train. I've seen you weight train, and people have this thing, no, oh, gym is not for me and stuff like that. You live in America, you live in Florida, one of the most beautiful places. People have beach bodies over there, and we have elderly people who have beach bodies. Can you, as a medical doctor, tell us about how important is movement, and then how much more important it is for the women who are pushing plus 40, plus 50, plus 60, and not a simple walking. Look at all the ladies who come to our clinic. They're like, I do walking, I do yoga. What else should they be doing?
So I think exercise, this is how I define exercise. Exercise and movement is basically elixir of youth. There is no other medicine that can act as a anti-aging as much as exercise do. You know, exercise is basically the paramount. It is essential, totally. Because when you exercise, and it's not only movement of just walking, it's basically a combination of both, walking, running, hiking, that all is good for your heart. I agree. I mean, that's all for your endurance. But when you're also incorporating muscle training, the resistance training and muscle strength kind of exercise, your weightlifting and your resistance training, you are basically strengthening your muscles. So this is the thing, after the age of 40, we all really decline in our muscle health. We lose the muscle mass to almost 4 to 8% every decade after the age of 40. And that
4 to
is
4
too
to
much.
8%.
That is huge. Yes. So after the age of 40, every decade we lose 4 to 8% of the muscle mass. And that condition is called sarcopenia. So if we do not control that, we are going to be on quite steep decline in our muscle mass, right? And we know that muscle is the organ of longevity. It is the organ of your youth. The more muscle you have, muscle acts like an incinerator for the glucose. That means that if you are, whatever you're eating mostly carbohydrates, fat, proteins, all that basically gets down to carbohydrates. So all that carbohydrate and glucose is disposed in the muscle. So more the muscle mass, you can dispose of a lot of glucose. So now because you're disposing that glucose in the muscle, right? So there is not too much free flowing glucose in your blood all the time. There are no those blood glucose spikes. And when you do not have those free flowing glucose, because the extra glucose, which does not get stored in the muscle or liver, it is free flowing in the blood vessels. When it is free flowing in the blood vessels, that will cause atherosclerosis, that is the heart disease. When it's free flowing in the blood vessels of kidney, it will cause nephropathy. When it is free flowing in the blood vessels around the brain, it is going to cause stroke. You're at high risk of having strokes. So that free flowing blood glucose is not good for you. It's extremely harmful for your health, right? So that is why muscle acts like a disposal for all that free flowing blood glucose. So that's why I call it, it's like your currency for glucose disposal. So I call it the elixir of youth. The muscle, you need to definitely have good amount of muscle in order to be looking good. If you have lean muscle, your whole body composition looks good. Your body looks nice and thin and lean. You look good. You have enough energy. You do not suffer from all these metabolic diseases like cardiovascular disease and obesity and diabetes. So that's why muscle is a very, very important organ of longevity. And exercise helps to build muscles. Definitely. So definitely I tell my clients to, in equal balance, incorporate the aerobic exercise because that's good for your heart, and also incorporate easily 140 to 50 minutes of resistance training in order to build the strong muscles. And especially for
That's
women, it's
150
very,
minutes
very.
per week.
150 per week. Yes, 150 minutes, because there's a recent study that's been done, and the data shows that if you're doing 150 minutes or 140 minutes of muscle training or resistance training or any kind of exercise, or incorporation of both the kind of exercise that I talked about, it helps to reduce your all-cause mortality by 18%. That's a huge reduction in all-cause mortality. And for men it's a little bit more, it's around 300. But this recent study that was done, it actually shows, it enlightened us that 150 minutes for women and around 300 minutes for men both of them, 80%, 18% reduction in all cause mortality.
So basically 30 minutes a day for 5 days a week would hit 150 minutes.
Yes, and that doesn't seem like a big. I mean, you can easily take out 30 minutes every day for 5 days a week. And I know, Ryan, you're very right. Some clients, they come like, who has time to do all this? And so then I explain it to them that it's just it's it's all about your mindset. I think the health and the movement and the exercise, I know it feels like a chore to you sometime, it feels like a work to do, and people feel lazy. But I think first of all, you really need to change the perspective around your health. You need to really change, you have to really have a strong mindset, right? And think that form a regimentation. If you have a good regimen, if you have a consistency, and if you have the repetition, because everything that you do in a consistent manner and everything that you do with rules and regimen, you will accomplish that goal. And once you are used to, then you can start slow. You can start with 10 minutes. Maybe you can build your routine up to 30 minutes later. But it's very easy. And people who are extremely busy, maybe you are entrepreneur, you have a startup company, you are extremely busy. I think exercise can be easily incorporated even if you are at your home. You don't need the expensive gym membership. Now, there's a recent study that I would like to talk about. So that recent study, the data actually shows some light. There's a exercise kind of a strategy which is called VILPA, VILPA. So that stands for vigorous intensity, lifestyle, physical activity. So that actually that data actually shed some light that if you're doing 3 minutes of very vigorous intensity exercise only 3 times a day, 3 times a day, only 3 minutes each. And that's not tough, right? I mean, you can easily take out 3 minutes 3 times a week. But it has to be vigorous intensity exercise. That means that your maximum heart rate should go to 80% of your max HR. So max heart rate is age minus 220, right? That's the formula to calculate max HR. When you know your max heart rate, do the exercise in a way that you bring it to around 80% of your max HR. That is what you call vilpa. And people who indulge in this kind of style of exercise, and when the study was completed, the results have shown that there's a 30% reduction in all cause mortality. And that's huge. I mean, that is tremendous. 30% reduction in all cause mortality with just indulging in 3 minutes 3 times a day. And I tell my people, and it's very simple and easy at home. You have to think about only three things, and that is some arm exercise, some leg exercise, and some aerobic exercise. So I just tell them, something to do with press and pull, and you can easily do that by doing the bench exercise, the bench press. And then when it comes to leg exercise, you can do the squats at home. You don't need the equipments, right? And then when it comes to aerobic, you can do some jumping jacks because that gets your heart rate to easily 80% of your max HR. So these three things, if you're doing, arm, legs, and aerobics all together at home, it's easily doable. You don't even need equipments. You don't need the gym. They can easily do it at home.
Dr. Mani, because you train so many clients, I know you have a lot of favorite exercises you do recommend to your clients start training. But there are a lot of people, especially homemakers, who don't even know what an exercise is. Could there be a chance that if they watch a YouTube video, they could injure themselves? And therefore, should it be important that they try and get a physical therapist, physical fitness trainer, or what we call as a traditional gym trainer, or an online specialist physiotherapist trainer to come and guide them for let's say the first 5 or 10 workouts? Do you feel this is an important point? Are you seeing women who suddenly take up physical activity getting injured, or are you just saying just start and the rest will follow?
I think I go by this strategy. People who are completely, just they are not completely sedentary. They are not mobile at all. I will actually encourage them to just get into motion. Start slow. If they're not doing anything but just sitting on the couch all the time, I think I would actually tell them to start walking. Once they are into walking and they have that dopamine rush, and they are now motivated to be doing more because they are seeing the results, then I'll tell them to be, slowly jogging. And once they are into that, once they're into that and they want to now go to the gym and do some muscle exercise, and they want to build their muscle, they want to lose the fat and build lean muscle mass, then I would definitely say that, it's a good idea to basically hire the trainer for at least 5 sessions, because it's very, very common. And I have seen this a lot, especially if you are not very young, and if you're middle aged around 40 years and you're women, and you, because of the hormones, you are actually, your bones are weak, right? And your muscles have been pretty static and immobile for so many years of your life, you can easily basically get victim of muscle injury, right? So I would say 4 to 5 sessions, definitely do it with the trainer, because that way you get accustomed to what kind of exercise you should be doing and what particular kind of exercise is good for what muscle, so that you don't injure yourself. I know not everybody is privileged to do that. In those kind of people, I would say just start slow. You can easily see the YouTube videos. I mean, just have a good sense, what is right and what is wrong for you, and just go easy. Don't just start with 10 pounds of weight. Start with 2 pounds of weight if you're doing yourself. But if you're
Slow
going
and
through
steady.
the route, yeah, go slow and steady is the key here. But if you're going through the route of aggressiveness, I would say definitely do it with the help of the trainer for first few sessions.
What I want to throw on light on this podcast, and if people have watched this far, is that everybody knows they're supposed to work out. Everybody is now knowing that they have to do the gym training. But what I wanted to touch base over here on is that when people come to my nutrition clinic, 67% of it is for weight loss. They are not focusing on the longevity and the muscle, which, if you train for about 9 months to 12 months, do you start seeing the muscle bloom. The muscle begins to rejuvenate. The muscle begins to come back to that 4 to 8% loss that you've had in the last decade. And it's only then when you strengthen the muscle, it's like a toddler, because you haven't used it so long, does it start to come out and say, okay, now I'm going to cooperate with you. And you're hitting menopause. I'm going to start helping you first maintain your weight for about a year or two, and then slowly you start losing weight. So uh, do you also see similar practice with your clients where, Dr. Manisha, I want to lose 10 kgs of weight by this New Year's? Is that something that you're seeing, or are people getting more aware and more responsible that they have to allow time both with the nutritionist, the medical integrative doctor, the trainer? What's your experience this thus far?
I couldn't agree with you more, Ryan, all that you said. I totally agree with you as an expert. All these clients coming to you, the very first thing that they talk to you, that we want to lose weight. But people got to, and I do face the same thing. I mean, many of my clients, they don't worry about the hormones. They don't worry about the whole picture of health. They don't worry about the muscle. They just think that losing weight is the key. I totally agree. Obesity is a big problem, and losing weight is the key to the health. But think about the whole picture. The whole spectrum is like when you build muscle, right? When you have the lean muscle mass, automatically your fat mass is reduced, right? Automatically your bone mass is increased. And then when you have a pretty good balance in between all those three alchemies, that your muscle mass is great, your fat mass is reduced, and your bone mass is looking pretty good, then you have a very beautiful composition of the body. And your body looks beautiful when you have the alchemy in between your muscle mass, fat mass, and bone mass. So definitely I agree with you that people just see the physical picture, but thinking inside, it's all about muscles. But at the same time, I know if you think human mindset, they all want to see the results in 5 6 weeks, but to build the muscle, it takes time. And that's why I tell people, go slow, because whatever has been built, all the rules and all your strategies that have been built uh, on a consistent basis, they will stick with you forever. those habits are going to stick with you forever. And muscle is the organ of elasticity, right? I mean, if you are training your muscle every day, it's going to be definitely, it's going to work out. But if you are just working out one day on your muscle and then you forget next 5 days and then you are working out the next day, that's not how you build the muscle. Because there is this muscle protein synthesis, it's called uh, MPS. So the concept is that these muscle fibers, when you go to the gym, your resistance training, your weightlifting, so basically you cause the inflammation or you cause the tear in the muscle protein, and that acts like a hormesis. It's like an intentional stress to the muscle. So whenever anything tear or anything breaks in our body goes into rejuvenation mode in order to build that. And when that happens with the muscle and your body actually is rebuilding those muscle fiber, you have a pretty good, nice, youthful muscle now. And that's what we are saying. That's what we say, building of muscle. That's what we say, muscle formation.
I use a line, muscle is the only age reversible organ in your body.
Exactly. Exactly. Very well said. Very well said. Because it's like an elastic. You can always, I know people say, okay, I'm 60-year old. I'm already way beyond that age. But I think there is no age limitation here. You can always be. I have seen 60-year-old, 65-year-old in a much better composition of their body compared to many 25-year-old women or girls who are basically all the time sitting and basically working on their cell phone and social media. Because it's all about training your body. Muscle is all about training. The more you teach, the more you let it go through that injury or workout, the more it's going to develop. And I think the muscle is the it's just not about muscle. I think when it comes to exercise and workout, so much is going on. Exercise is good for your brain health. Exercise is good for your, all cause, it reduces the all cause mortality, is good for your immunity, is good for your happiness. When you exercise, all those nice, good neurotransmitters like serotonins and dopamines are released, which are good for your happiness. It keeps your mood elevated, it keeps your mood happy. And not only that, when you are exercising, and especially when you're going into quite intense exercise, there's a molecule that our body produces, and that is called lactic acid. We build up the lactic acid. People have this somehow picture in the mind that lactic acid is bad, you need to flush it out by drinking water. But no, that lactate that you produce at that time is really good for your brain, because that lactate actually crosses the blood brain barrier, it goes in your brain, it acts as a fuel for your brain cells. And when your brain cells, that is neurons, get that food for them, they become active. They kind of wire and fire with each other. And when these brain cells are wiring and firing with each other, that reduces your neuroplasticity. And we all know neuroplasticity is the cause for cognition problems, memory problems, is the cause for Alzheimer. When we are not neuroplastic, when our brain is not neuroplastic, we have tendency to focus more, learn more, and adapt more to the newer trends. We are ready to learn. We are not plastic. We are not stiff at that time. That's why it is really needed for your brain to be not neuroplastic. You need to reduce the neuroplasticity at any cost. Plus, also, there was a recent research done. This lactate that is produced, so this lactate, it gets converted into the short chain fatty acids called propionate or propionic acid in the gut. When you consume all that, when all this lactate gets converted into propionate, this propionate acts as a fuel for all these gut microbiomes. So your gut is more actually healthy because of exercising. So you see how your overall health is also affected. And this propionate is also one of the molecule that makes the athletes more active and more strong. So there's a lot of connection between exercise, muscle building, happiness, overall immunity, overall strength.
I'm going to ask you about your skincare routine, but before I get there, I always use this example to women. I was like, you go to the beauty parlor. Do you ever stop going to the beauty parlor? My mom is 77 and she still goes to the beauty parlor. Okay. She gets her hair done. She'll do some coloring. She'll do this. She'll do that. I'm like, one day it's just said, Mom, will you ever stop going to the beauty parlor? She says, till the day I die, you make sure I have makeup on my face and get my hair done properly. And that got me to think women are so resilient in terms of how they look. If they can only take this point that exercise is actually the makeup for anti aging.
Absolutely.
And you just have to turn up every day and you put that foundation, blush on, lipstick, eyeliner, mascara. I watched my mother dress up all my life and watched her put on all of these things. And going to the gym, um, I think my 10th wedding anniversary, I gifted my wife a personal trainer subscription for the full year. And I think the first week she was not too happy about it. She was like, hmm. But 3 months later, she came back to me. She says, this is the best gift ever. I am glowing from inside. I'm glowing from
Right.
outside. My cellulite is disappearing. My wrinkles are looking like tight. And then she's like, give me collagen, give me this, give me that. But you have a routine, and I see it on the internet. Two routines I want to pick your brain because that's what our fans and listeners want to know. What does this beautiful doctor do? I mean, she's talking, she's intelligent, she's quoting studies, she's saying propionate, she's saying muscle protein synthesis. Give us in short, what do you do in the gym? Give us in short, what is your skincare routine?
My skincare routine is quite extensive. I have to say that because I think from this point of view, the skin is the reflection of your overall health. One is taking care of your overall health, and that's very basic. And I will. We have touched on that topic already. But I think skin is the very first and the frontmost organ of your body that shows your vitality, that shows your inner reflection. That's why I'm all about skin. I talk about skin health, but skin health has to do all about from the overall health point of view. But as far as my skin routine, this is what I do when I wake up in the morning. First of all, I never wake up by alarm. It's just a natural waking up, because if I know I have been taking restful
Same here.
night's sleep,
Same
yes,
here.
because I somehow, Ryan, I get stressed out by those sounds. I know that if I've slept enough, if my body is rested enough, your circadian rhythm is going to, basically your inner biology is going to wake you up at the same time consistently every day. So I wake up 6:15, around 6 o'clock, and the very first thing that I do is step outside. I try to take all that sunlight as much as possible for 10 minutes in order to balance, in order to optimize my circadian rhythm, right? And then I drink water with Celtic water, with Celtic salt. And I think with also some lemon in it. I consume that whole one small 12 ounce of thing, water, and water, warm water with lemon and Celtic salt. I think that's a very good proportion of electrolytes. Why I believe in electrolytes a lot. Electrolytes and minerals, they are the micronutrients. I know all of us keep talking about protein, carbohydrate, fats. They're all macronutrients. We all are well aware of those. But people never talk about micronutrients, and that is electrolytes and minerals. So I consume electrolytes and minerals because they are those essential molecules that keeps your body, that keeps your cells, that keeps your whole body charged. You know, we as a human being, we are more electrical than chemical. You know how our heart is electrical, how when we suffer from heart failure, the whole ambulance, all the paramedicals, they kind of just rush us to the hospital, and the doctors give us the defibrillator, the electric charge to charge our heart, right? So it's all electrical. So if you have to provide enough electrolyte, and that's what I do the very first thing in the morning. My first glass of water is full with electrolyte, so I give my body the flush of all those electrolytes, so my body is nicely charged enough, and then I can actually go start doing my work. So my skincare routine is, I definitely take the ice roller and kind of just smear it on my face, because that takes care of puffiness, that reduces that causes vasoconstriction. So it kind of just reduces the puffiness, and then I go through all my skin routine, which I don't know I want to talk on this podcast. Maybe you're not meaning that, but I do take care a lot of my skin. by using the serums and moisturizer. And I do definitely good cocktail of serums. I know that hyaluronic acid is good for you, the peptides are good for your skin cells, and then also all those anti-aging serums that I kind of just mix together, apply them. And my one of the technique is to just go up, because I do not go to the aesthetician that much as many people in my age go, because I believe, again, just like your wife said, the beauty comes from all within. It's from within, it starts from your inside. So I just take care of my skin, drink a lot of water, because hydration with electrolyte is a must. And definitely the topical serums and topical moisturizer, I smear my skin in that, and I do believe in that. And then regular cleaning. Yeah.
Yeah, I remember once I was working for this American brand and they had this statement, cleanse, don't moisturize, CTM. And
Yes.
I remember I didn't do any of that. And obviously, if we can educate more youngsters outside there to take care of the external beauty with cleansing, toning, moisturizing, alkaline water, Celtic water, lemon water, hydrating really well, eliminating bad sugars in the diet. Now, I wanted to go into the internal beauty and the nutrition part. One, you talked a lot about how important is the diet, and I've seen videos where you're choosing your produce in farmers markets. You're quite particular about eating organic, and so one part is eating clean. That is a God given in your textbook, Dr. Mani. What about nutritional supplements? I always say supplements are a nutritional convenience, maybe for your nutritional indiscipline. But of late, as I'm hitting 50, I realize there are a lot of products, both from an anti aging point of view, both from a genetic health predisposition to, let's say, having higher cholesterol. I want to take a nutritional supplement for that. What's your take on nutritional supplements? Are you thumbs up? Are you thumbs down? Can you explain to us why it's important to work with a medical physician or a medical dietitian on your nutritional supplement prescription? And what are the secret stuffs that you take?
Definitely, Ryan. The very first approach I tell my client is the food first approach. That is non negotiable, right? You need to make sure that you're having the organic, clean food. Try to make sure that you're having the whole food. For people who don't understand what is she talking about, what is whole food is something with single ingredients. When you look at the package and their labels, if it has tons of stuff in the ingredients, don't consume it. That's a red flag. Don't consume over processed food. Make sure that you're eating single ingredients whole food, like salmon, like avocado, apple. So that is all single ingredients whole food. And then definitely in this modern era, the food is all sprayed with pesticides. That's why I really like to indulge into the organic eating. So that is the food first approach. Avoid any kind of ultra processed food. The second approach is definitely supplements. And as to your question, I definitely agree with you. These supplements should be definitely moderated and governed under the guidance of the medical nutritionist or a doctor or your physician or any integrative wellness practitioner that you're seeing, because you really need to make sure what is your level and how much are you consuming, how much supplements are you consuming, and then you should be doing your repeated tests to see how much is the betterment. So it should be definitely monitored under the care of the expert. The kind of supplements that I believe, which are very basic supplements and then very easily available, but definitely take high quality supplements. The three supplements that I always talk about is, which are non-negotiable, is vitamin D with combination of K2. Second is omega-3 fatty acids, and third is magnesium. So all these three supplements, in the older era, maybe our ancestors, all these things are called, again, micronutrients. They were available within the food. But nowadays, there are so many reasons that we are not consuming either enough food, we are not consuming the nutrients, we are not consuming these nutrients because our gut is not absorbing well. Our intestines are not absorbing these nutrients very well. Maybe we have food sensitivity problem, maybe we have food allergy problem, and the other major problem is our soil. All these crops and agriculture is so deficient, all the soil is so deficient in providing us all these nutrients, so we are automatically going to be quite deficient in these three supplements that I talked about, which are essential for your health. So these are my three go to supplements, definitely.
Awesome. If you were walking through the supermarket, three foods that you would put into your supermarket bag for your glowing skin.
Oh, I have so many, but to pick three is kind of tough. But I'm going to pick three, and they are my pick three. One is salmon, definitely. I believe in the power of fish. I will definitely not consume the big fish like swordfish or halibut, but definitely I believe in the seafood like small fish like sardines and salmon because they have low content of mercury, but at the same time they are high content of omega-3 fatty acids, which is amazing for your skin, and it reduces the skin inflammation. So that is one food. Second is avocado. I love avocado, and it again has all those beautiful fatty acids that you need for your skin. And then I love berries, blueberries. And this is what I tell my clients: if you have selection of fruits, start to go towards the darker option. Start to, I mean, if you're consuming mango, don't do that. Go towards the darker option because they have more cyanin, they have more bioavailable phytonutrients, which is good for your body. So if you're eating strawberry, go for blueberries. If you're eating blueberries, go for blackberries. So go for more darker pigmented fruits because that's good for you. So I do consume a lot of berries: strawberries, blueberries, blackberries. That's my choice. So these are my three picks for the skin health.
With putting an asterisk on those berries, as a doctor, do you look for the organic berries because we know that they come under the dirty dozen, which is the high pesticide? So, do you intentionally go out and hunt out the organic berries? Are you okay with dried organic berries? What's your take on that?
Absolutely, absolutely. I'm very happy, Ryan, you brought that point because that's never to be mentioned. That's never to be missed, actually. That point is never to be missed. When you consume berries, please consume all organic because they do fall in the dirty dozen category, and you need to go for the organic ones. That should be the choice, definitely.
It's very easy to go overboard on eating berries. So, for most women, as a doctor, how much would you recommend to them to eat in a day?
That's actually a good question to you, but for me, I don't consume more than half a cup. That is
And that's
enough
what
for
I
the
would
day.
recommend to most women, which is maximum 3 tablespoons. 3 tablespoons at the maximum, which would be a nice full handful. But if somebody's on a weight loss program, then I kind of tell them to look at the dehydrated berry, organic berry powder. So the chances of sugar after it's being dehydrated actually half. And so you get the anthocyanins, you get the polyphenols and the flavonoids and the phytonutrients, minus the water that has been pulled out with some of the juices of sugar in that.
Yeah, very good. Actually, that's a very good strategy. That if your goal is to lose weight, go for the dry berry. I like that. Yes.
And it's also easier because then you don't have to go to the supermarket every week and get fresh stuff and keep it in your fridge. And
Yes.
so people always have this debate with me: fresh versus canned, fresh versus dehydrated. And you kind of look at the bioavailability. And I just tell people the first thing is go organic, like you said. Let's go find organic stuff. Second is to look at the portion control of that, but do it more frequently. So instead of eating berries once a week, you eat it every day, but you portion control it every day so you don't go overboard, and you're bathing your body in those phytonutrients on a daily basis.
Absolutely.
Speaking of phytonutrients, we like you get a lot of postmenopausal women. Three supplements as a doctor generally that I had a lady the other day come in and is like, oh, I don't want any supplements, I'm 50 plus and I'm not going to take any supplements, I want everything natural. And then I went on to explain to her that my viewpoint would be, let's get you genetically tested, let's get you blood tested, let's get you omega-3 tested, let's get you microbiome tested. So like, I'll do all of that but no supplements. Is there any three supplements that you would blindly give to a woman going through her menopause? And would this advice, I will put the medical disclaimer, please consult your medical physician or family doctor or gynecologist or medical dietitian or integrative wellness practitioner. I'll put that asterisk. But Dr. Mani, you as a medical physician and an integrative nutrition expert, what is your best three supplements that you like?
So I think the three best supplements for the menopausal women. Very good that you said that you're going to put the asterisks and go to your medical doctor's advice. Definitely, since biology of each woman is different. We all are bio individual, right? So what my requirement is, maybe the other women's requirement is not the same, right? Or the protocol that I follow, she might follow different. So we all are bio individual, at basic levels. It's just different. But three basic supplements that I really recommend to my clients in general is fiber. Number two is L-theanine, because that calms your stress. Or I also do take magnesium threonate, because that kind of just calms you, because that kind of just balance your stress. And definitely magnesium. And the other one, which I highly recommend, is make sure that your iodine and your selenium is up to the par, based on your medical blood testing, because selenium decreases. I mean, selenium is an important mineral again in your body, right? And if your selenium is not sufficient, and many people have selenium deficiency, so then your thyroid gets affected. And women are so prone to this problem called hypothyroidism, and it kind of just gets unnoticed. So it's very important to make sure that your food is good in magnesium and selenium as far as your reproductive fertility and your women's health is concerned and thyroid is concerned. This is one, then second is fiber, and then the third one is L-theanine to kind of just calm your stress. These are the three to-go supplements for the menopausal or for women's health.
Awesome. Um, those are the good parts. You can take an Indian out of India, but you can't take the Indian out of an Indian. I'm not going to talk to you about what's your favorite Indian dish, both healthy and unhealthy.
Oh, so my favorite Indian dish is paneer, definitely, because I like it because one, it has good amount of protein, and it's good. I don't know, somehow, and I'm from north of India, so somehow the paneer is kind of just just been built in my that taste bud is so active still in my tongue. So I like paneer, which is good, but at the same time, just like you said, just don't go overboard on the quantity, just have portion control. So I go by portion control. I like paneer. And what I do not like, that's what also is a question, what I don't
Yeah,
like.
it's kind of what you know what is healthy, and also know what is like a favorite Indian dish that is unhealthy.
It may be health wise, it may be good. It's just maybe personally me, I cannot eat lot of beans and rajma, because it kind of just mess my tummy. It is just too much for me to metabolize that kind of carbohydrate. I know it's a good mixture of carbohydrates, fiber, and protein, but it doesn't work for many of us, because it's just something in the layer of it, that pectin layer. Even if I pressure cook it and try to remove that pectin layer on the top, which actually messes our tummy, even then it's too bad for me. It doesn't work. So that's something that people who consume it, make sure the portion control, and make sure that it suits you. I mean, your stomach or your intestine might be sensitive, then don't consume it.
Dr. Mani, I've been doing the genetic testing since 2013 at our clinics in India, and the microbiome we started about 4 years ago. And when I studied at Goa Medical College, we were taught one size fits all.
Mm.
But the revelations began to come with the diagnostic testings, the blood testing, the genetic testing, and the microbiome testing. It's very interesting. I had this one client once who did the food intolerance blood test. They were not allergic to wheat. And then when we did the genetic test said this genetic profiling should not be eating wheat. And then what we did is we did 3 months of eating wheat, and the patient said, I'm completely fine. And then we did 3 months of not eating the wheat. But then I also looked at other markers like resting heart rate,
Mhm.
respiration rate of the exercise variables, and I looked at the ESR and C reactive protein levels.
Mhm.
And I carefully tracked the homocysteine lipoprotein A, lipoprotein B levels, and it's got nothing to do with wheat and gluten. So patient didn't feel much of a difference. But statistically, in the measurements, I saw significant impact, even though the food intolerance test said no problem. The genetics says there is a problem. You could see the underlying problem, which would manifest its head later on in life. So, your thought process that it does not agree with me is absolutely right. It's bio individualized. Research is now showing some people, because of C-section birth, may not have that necessary microbiome in them. So that population of bacteria to digest fiber or assimilate uric acid or pectin changes. So even uric acid, even flatulence will go northwards or southwards for different patients. So I'll give you a simple example. You put a CGM, a continuous glucose monitoring device, on your arm, and if you have a sibling, like I have a sibling, and we did orange, pomegranate, we actually got different readings, though we're of the same genetic makeup. So one is genetics, but then the microbiome, which is more amount of bacteria than human cells, has its own DNA profiling. So these bacteria actually eat the food first before you eat it and poop it back into you. So
Right.
you have the good guys, as we call as the good cops, and then the bad guys, who's called the gundas, as we say in India. So, Dr. Manisha, maybe the good cop doesn't exist in your gut to digest that rajma.
Yeah.
And it's not a function that you're a North Indian and you can't digest it. It's a function of your microbiome. So, this has been an amazing chat with you. Before I let you go, a lot of people follow us. Um, I want all my American clients to know who you are. Where can we find you? Do you have a website and do you have an Instagram profile? I'll be putting the link in the descriptor of this podcast. But if you can tell us what your handles are, that's where people can click and find you and get in touch with you.
So my website is livagewell.net, livagewell.net, and you can find me at my Instagram all the time. I'm there quite active, and that is dr.money mani .kukreja, and that's where you can find me. I love to spread the information. I'm an educator and entrepreneur by nature, but then I do spread a lot of information through Instagram and through corporate speaking. And I mean, it's been wonderful, talking it out with the community. That awareness is so important, I think, and it's all about building that awareness around health. Everybody needs to be educated and knowing those tools that they can actually hold, and those strategies and methods that they can actually follow in order to take control of their own health.
I'm going to ask you three questions before I let you go. Very quick ones. Your wellness mantra in one sentence.
Good night and restful sleep.
If you were Prime Minister of India, of the largest population in the world, which is the youngest workforce, but has the potential to be the sickest population on the planet, and you were prime minister, what would be something that you would change for
I
India?
will definitely change the food culture. I'll try to make it clean and organic to be readily available to everybody, not only to the privileged population, but to everybody.
I second you on that. I'd like to be your food minister in that, and hopefully we can get it changed. Final thing, we have a lot of dietitians who follow you. We have a lot of medical doctors who follow you. What's one i- health book or medical book or wellness book that you feel that people should read?
I think all the books by Dr. Mark Hyman, they are amazing. They are beautiful health books because they do combine the medical and the layman along with all the food and nutrients. And I just love all those. Dr.
Dr. Mark
Mark Hyman
Hyman
books.
is a rock star in his
He's a rock star.
profession. I was reading his latest book, Young Forever,
Young
and
forever. Yes.
I remember marking a chapter in that to tell all my dietitians, and like, did you know that Dr. Mark Hyman has written about Indian tartary buckwheat? And they were like,
Mm-hmm.
yeah, it's good too. I'm like, no, the Himalayan buckwheat has something called
Himalayan.
hobamine in it. And I
Yes.
was like, hobamine, I never heard of it before. Dr. Mark
Yeah.
Hyman is actually
Yeah.
an anti-aging molecule. So I went to my wife and I was like, find me a Himalayan tartary buckwheat farm. We need to buy it because we need to
Hmm.
keep young for the rest of your life. But
Yeah.
you are the youngest looking guest I've ever had on my podcast, and
Thank you.
I can't ask a woman her age. But we're going to do this again, and I'm going to come across to America. I'm going to invite you to India. If there was Dr. Money, the 22-year-old version out there, partying, rave parties in Goa, Las Vegas, alcohol, drinking, everything, and you could transport yourself back in time to meet that 22-year-old. It's not you, it's the general youth today. What's one message you would give everyone?
That health is the foundation of goodness. Try to take control of your health right from right age. There is no limit, even if you're 20, 22, 15-year old. It's all about habits. All the habits that you develop at the early age, the better it is for your rest of the life. I mean, you have to just set up that routine for rest of your life. And health is the goodness. It's about health is all about humanity. It's about sustenance. It's about living. So just take control of your health.
Awesome, Dr. Mani. It's a privilege to host a course with you, where we talk about immunity. It's a privilege to have you today on the podcast. You're changing lives across the world, and I'm looking forward to that book that's coming out. I take first dibs on an interview with you about this secret book that you're writing, and hopefully all our viewers um, will get sneak preview into what secrets that you're launching out there. Dr. Mani, it's been a pleasure talking to you. Stay safe and see you on this side of the world soon.
Thank you for having me. Thank you. It was delightful. Thank you.
You're welcome.
Thank you for watching this far. It's been an amazing episode, and I'm so grateful to have you till the end. If you like this video, please share this video with your loved ones. Better still, gift me a subscribe, a like, or even a comment, and we'll come back to you.